Hello.
Hi.
Hi, Brittany. How's it going?
Good, how are you?
I'm doing well, thank you for asking. My name is Dr. Perez. It's very nice to meet you.
Nice to meet you.
Welcome to the clinic. You are a first-time patient here, so I appreciate you for coming in. So it looks like I have you in for your first head-to-toe assessment today. Okay? As you are a new patient, we have quite a few things that we will be testing. I'm going to start at your head and then work my way down and have a look at your feet. Is there anything prominent going on today? Anything specific that you wanted me to keep a special eye on?
Not really.
No, so just kind of a general assessment, making sure everything's good to go. Okay. I'm going to get started by cleansing my hands and we can get started. Are you new to the area or just switching practitioners?
I'm new to the area.
New to the area. Well, welcome. It's lovely to have you. All right, so I typically like to get started by just asking how you're feeling today. So do you feel generally well, generally unwell, any ailments, pain, headache?
No, I feel well.
Feel well? Good. Okay. Did you have breakfast this morning?
No.
No breakfast. Okay. That's okay. I just like to ask. So we can go ahead and get started. Typically the first thing I do is just perform a visual assessment. So essentially just kind of having a look at things, checking for symmetry of the face, any kind of facial drooping or any obvious bruising, cuts or abrasions, that kind of thing. Okay. So any recent injuries to your head or anything?
No.
Okay. Is it okay if I go ahead and touch
Yeah,
you? I'm just going to move your hair. So just having a look at the overall facial symmetry, looking at the eyes and eyebrows, as well as bone structure and lips, looking for any drooping at the mouth, which is not present today. So also just looking at the clavicle and lymph node area for any signs of distension. Thyroid appears midline, and of course having a look at the shoulders and arms in proximity to the legs. All of that looks okay. Can you just confirm your height for me?
I'm 5'7".
5'7", okay. Very good. If I could just have you sit up with your shoulders back. Okay, you can go ahead and relax. Very good. So I'm essentially going to perform the same test just with my pen light as soon as I locate it. I believe it's in my pocket. All right, so this light is fairly bright. I will be shining it at your face. You don't have to look at the light. Okay. Go ahead and just look off to the side. So just gonna have a look around the hairline, looking for any obvious abnormalities there. Just peeking over at your carotid pulse, looking for any signs of distension. And again, having a look at the clavicle. So skin tone is very even and clear, not noting any abnormalities there, no abnormal blemishes or any signs of broken skin. Can I just have you flip your arms for me? Perfect. Okay, very good. No reddening at the palms or abnormal skin texture there. So it does look like you have artificial nails. Do you ever have any trouble with these?
No.
Okay. Very good. Nail beds appear healthy. No issue with the cuticle. Same thing on this side. Not noting any abnormality there. Very good. Okay. Just going to have a look at the abdominal area. I will perform a brief abdominal assessment, just looking for any signs of distension at the umbilicus, which is not noted. Very good. So I will have a look at your lower extremities as we move forward with the examination, but so far everything looks okay. All right. Very good. Okay, so we can go ahead and move on, and I think the first thing I'm going to do is perform an auscultation assessment. So I'm just going to place my stethoscope on, have a listen to your heart and lungs, and see how everything's going. Have you ever seen a cardiologist for anything specific?
No.
Okay. No trouble with heart palpitations or anything?
No.
Shortness of breath? This is very cold, just to give you a warning. Okay, so I'm just going to start here. Going to listen at the carotid artery on both sides. Good. If I could just have you sit up straight for me, I'm just going to listen under the breastbone. Very good. And if I could just have you turn away slightly so I can listen to your lungs. Very good. Lung sounds are clear. Okay, I'm going to ask you to take a deep breath in and hold it for 3 seconds. Good. Go ahead and release. One more time. And release. Very good. You're going to feel me tap on your back 2 times. After each second time, I'd like you to say 99.
99. 99. 99. 99.
Very good. Okay. You can go ahead and return forward facing for me. Everything sounds great. Cardiac assessment was clear. Your heart rate is well within normal limits. Normal sinus rhythm, which just means there's no abnormal heartbeat, and your lungs sound great. Okay. So we can go ahead and move on. I think I'd like to do a bit of a palpatory assessment. So I'm just going to feel around your scalp and your face, see if there's anything abnormal, any abnormal lumps or bumps, anything like that. Obviously, there shouldn't be if you haven't had any injuries, but just safe to check. So I'm going to go ahead and place my gloves on at this point. I'm feeling very pink today. Okay, so if anything is uncomfortable or painful, if you feel any tender spots, just let me know. Okay? So I'm just going to start here at the hairline. So far, not feeling any abnormal nodules. Going into the front portion of the scalp. Not feeling anything. Just palpating at the crown. And feeling at the nape of the neck, no signs of swelling or edema there. Just going to come over on this side. Do you ever have any pain or tenderness at the ear?
No.
No. Okay, so I'm just going to palpate around here. So do see a couple of piercings and they have appeared to heal well. Have you had these for a while?
Yeah.
Okay. So I'm not seeing any issues there. Good. Same thing on the other side here. Just gonna have you turn your head slightly for me. Perfect. No signs of swelling or distension there. Okay, so I'm just going to palpate around your face. I'll have you just close your eyes for me. Just manipulating around the brow bone. And gently above the eye. Along the orbital socket, I'm not feeling any abnormality there either. So I'm just going to palpate along your lymph nodes, looking for any signs of swelling, any abnormal nodules here that could indicate a sign of infection. And palpating along the thyroid, not feeling anything there. So clavicular lymph nodes are not palpable, which is great. If I can have you shrug and kind of pull up your collarbone, perfect. Okay, you can go ahead and relax. All of that looks good. So I'm just going to palpate along your arms. Just feeling for muscle tone, any signs of wasting. Your arms are quite toned. Do you work out regularly?
Yeah.
Very good. A little bit of freckling, nothing that I would say is concerning. Do you typically wear sunscreen if you're out for a prolonged period of time?
I could be better.
Could be better about it, okay. So that is the common answer. Definitely recommend wearing sunscreen if you have prolonged sun exposure, which is more than 30 minutes of consistent exposure. So just something to be cognizant about, especially areas that are more exposed to the skin like the face and hands. All of that does look okay. All right, very good. And I will do your lower body assessment once we kind of move downwards. So let's go ahead and move on. I think the next thing I want to do is just a check for any temperature abnormalities. Now this is fairly standard. Your vital signs were all within normal limits when the nurse obtained them. I just like to do a double check, checking specifically around the lymph nodes, just ruling out any signs of infection. So I'm just going to use my thermometer gun. Okay. So just checking around a couple different areas. Forehead is actually a little bit warm. Are you feeling warm?
A little bit.
So just a couple abnormal readings there. Could just be that you're nervous or that you just typically run hot. That's okay. All right, so let's go ahead and move on to our eye exam. So there's a couple things I'm going to test here. This is probably the most extensive portion of the examination as a whole. The first thing I'm going to do is test for your pupillary reflexes. Now you do have very light colored eyes, so you might be a little sensitive to the light. So I'm going to have you just kind of look straight ahead at one of the pictures on the wall for me. Now, of course, let me know if any of this causes you any discomfort. So just checking for normal pupillary constriction and dilation. Very good. Okay. Consecutive responses, normal. Very good. Okay. So this time I'm going to have you follow the light with just your eyes. Try to keep your head straight if you can. Very good. So follow it out for me, and then we're going to come all the way in towards the bridge of the nose. Good. Any tenderness of the eyes there?
No.
Okay. All right. So just one more lighted test, and then I will move on. So this device is called an ophthalmoscope, and it's just going to allow me to have a look inside your eye and view your optic disc, which is the disc that's behind your retina. So I'm going to have you just look off to the side here. I'm going to come very close to your face. Okay, so optic disc is visualized, and I'm not noting any abnormality there. No signs of cloudiness. Very good. Okay, so just do the same thing on the other side. All right, so I'll just have you look here. Okay, so both sides are visualized with no visual impairments. Very good. Do you know the last time you saw an optometrist?
I've never.
You've never been to an optometrist. Okay, so typically no issues with your vision. All right, Brittany, so we are going to move on. Now, you've never seen an optometrist. I am going to do a very brief test of your visual acuity. So there's just a little chart. It's called a Snellen chart. I'm sure you've seen it. It just has a bunch of letters on it. I'm going to hold it about an arm's length away from your face. I'd like you to just attempt to read the letters for me. Okay, so if you could read the very top line there.
E.
Very good. And if we can skip to that third line.
F. P. H.
And what is the lowest line you can read at this distance?
L. T. F. P. H.
Perfect. So I'm going to have you repeat that lower line for me. I'm just going to use this occluder to block one of your eyes.
L. T. F. P. H.
Perfect. And I'm going to do the opposite eye. This time I'd like you to read the line backwards.
H. P. F. T. L.
Very good. So your vision is at 20/20. I am going to go ahead and do a brief test for color deficiency or color blindness. Do you find that you ever have trouble seeing specific colors?
No.
Okay. So these are called Ishihara test plates. You're going to see a circle plate with a number in it. Can you tell me what number you see here?
12.
Very good. All right. And second page, do you see a number here?
8.
And here?
5.
Very good. Skipping ahead here.
2. I don't see it.
Very good. So that one is a test. Anything here?
16.
In here?
No number.
Do you see a pattern or anything here?
Yeah.
If I could have you trace the pattern with your index finger. Very good. And last one here. See anything here?
There's a pattern.
And if you could trace that with your opposite hand for me. Very good. So no issues with color blindness or color deficiency. That's a very good sign. Now the next thing I'm going to do is test for your blind spot, also testing for any cloudiness or opaqueness of the retina. So first thing I'm going to do is hold the occluder over your eye. I'm going to bring a device into your field of vision. I'd like you to let me know if and when you see it. So firstly, can you tell me what color this is?
It's clear with a yellow cap.
Very good. So I'm just going to hold this up here. Actually, if I could have you hold this for me. All right, can you see this here?
Yes.
So I'm going to move it out of your visual field. I'd like you to tell me when it reappears.
Okay.
Okay. Can you see it here?
No. It's appearing.
Good.
It's appearing.
Good.
It's appearing. It's appearing. It's appearing.
Good, and we'll do that with the other eye. So if I can go ahead and have you switch for me. You see this here? What color is it?
Clear with a gray cap.
Very good. Can you see it here?
No. Here. 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 Here.
Very good. Okay, so no issues with your blind spot. Go ahead and take this from you. I'm just going to occlude both eyes now. You should still be able to see my fingers here. Can you tell me how many fingers I'm holding up?
4, 2, 5, 1, 3.
Perfect. So same thing on this side. Can you see my fingers here?
Yes. 1, 3, 2,
Good job.
4, 1.
Perfect. Okay, so you did very well. And that does conclude your eye examination. Okay, so certainly no issues there, and we can go ahead and move forward. So I am going to move on to your nose examination. Any issues with your nose, seasonal allergies, any?
I do have some seasonal allergies, but they're
allergies.
not too intense.
Do you take anything for it?
No, they're not that bad.
Typically not that bad. Okay. So seasonal allergies are obviously very common. I'm just going to have a look inside your nose with my ophthalmoscope. With my otoscope. So if I can have you tilt your head back slightly for me. I'm just going to lift at the bridge of the nose and have a look at your nares. Just looking for any notable signs of swelling or occlusion, any deviation of the septum or abnormal mucosa, which is not present. Very clear. Good. Okay. So I'm going to do a test for nasal patency, which just means how well you breathe through both nostrils. So I will occlude one side. If I could have you breathe in. Very good. And this side. Very good. I'll occlude both sides and have you breathe through your mouth. Very good. So no feasible issues with that. Typically, if you were having any issues with your sense of smell, then we would test that, but obviously you seem to be okay, so we will skip that for today. If I could have you open and say, "Ah," very good, and tongue out, "Ah." Okay, uvula is midline. If you could lift your tongue to the roof of your mouth. Good. If I could have you smile and show your teeth. Smile, no teeth. Very good. So no signs of drooping at the face. Do you see a dentist or orthodontist regularly?
Yes, I do.
Any issues with your teeth or your gum health?
No.
Brushing and flossing regularly?
Yes.
Very good. Okay. Alrighty, we can go ahead and move forward. So why don't we perform a follow-up test of your ears now? You said you don't typically have any issues with your ears or your hearing. Do you frequent loud events, concerts, sporting events, that kind of thing?
I listen to very loud music in the gym.
Okay. Headphones?
Yes.
Are they over the ear or in ear?
They're over the ear.
Okay. Do you ever find that you have any ringing of the ears or that kind of thing?
Occasionally.
Occasionally, okay. So definitely want to be cognizant of that. If you have an iPhone and you tend to connect your earbuds to your iPhone, it will tell you if the decibels are too loud. It's likely that it is, especially if you're at the gym. So just try to be aware of that. Ideally, you should be able to hear the surroundings outside of the earbuds. Obviously, that kind of defeats the purpose, but just be cognizant because it can really affect your hearing with long-term use. Okay? So I'm going to go ahead and do a brief test of your hearing. Okay. So I'll just have you close your eyes for me. I'll test a couple different things. The first thing you should hear is just the light sound with my hands. I'd like you to just say yes if and when you hear something, okay?
Okay. Yes. 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 Yes.
Very good. Now I'm going to test with a secondary object. This time if you could tell me what side you hear it on.
Okay. Right. Middle.
Very good.
Left. 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 Right. Middle. Middle. Right.
Okay, so now I'm going to start on one side. I'd like you to tell me what side I end on.
Right. Left. Right. Left.
Very good. Okay, so I'm going to produce a sound. Tell me if you hear this equally on both sides.
Yes.
And now,
Right.
very good. Equally on both sides.
Yes.
And now,
Left.
very good.
Right.
Very good. Tell me when it stops.
Stop.
Good. Tell me which is louder, 1 or 2.
2.
Very good. Can you hear this here?
Yes.
Tell me when it stops.
Stop.
Very good. And tell me which is louder, 1 or 2.
2.
Good. Okay, so bone conduction test is normal and your hearing is obviously intact, so that's very good. All right, so we can go ahead and move forward. Now, I think the next thing I'm going to test for is your blue light response. So this is just a very short secondary test for your eye exam. Do you spend a lot of time on a computer, iPad, iPhone?
My phone.
Okay, how many hours a day would you say you average on your phone?
A few. I don't know exactly, but definitely at the nighttime when I'm just
Okay.
winding down.
Do you know if you have the blue light blocker set, like nighttime mode can turn
I
on?
put night shift on when
Okay.
I get in bed.
Very good. Okay, so that blue light is what really affects your vision, especially at night. It can affect your circadian rhythm and your production of melatonin. So very good that you turn that on. I have mine set to come on automatically at 9 o'clock. So this is going to simulate a blue light. I'm going to bring it into your vision. I want you to tell me if you see any floaters or double vision.
Okay.
So I'll have you look here for me. Okay. Any pain or discomfort there?
No.
No floaters or little dots?
No.
Okay, very good. All right, Brittany, you are doing very well. So we can go ahead and move on. Now, I'm just going to do just a measurement of your upper extremity, checking for symmetry. Can I have you hold your hands out extended for me? And then I'll just bring your hands up. Very good. So starting at the scapular indentation, I'm just going to measure about 28.5 inches there, and right at about 7. Okay, go ahead and relax this arm for me. I'll repeat the same on the other side. Okay. you left or right-handed?
I'm right-handed.
Okay. Very good. So your left arm is slightly shorter, but that is normal compared to your dominant side, so that's okay. Okay, so we are going to move on to a test of your upper extremity reflexes. All right, so I am going to test starting at your jaw. So if I could have you hang your jaw just very lazily for me, so just open slightly. Very good. Any pain or tenderness there? Okay. So I'm going to test your ocular reflexes. You have muscles in your eyes that will cause you to blink if something comes near your face. So I'm going to have you look forward for me. Bring this hammer very close to your eyes. Obviously, I will not be striking you with it. I'll just be testing to see your blink reflex. Very good. And while I have this hammer, I'm going to percuss along the jawline. Any issues with clicking or popping of the jaw?
No.
Do you grind your teeth at all?
No.
Okay. So if I can have you open for me and close and open and close. One more time. Close. Good. Okay. All right. So in line with your reflex testing, just have a sterile little cotton wisp here. I'm going to bring this to the corner of your eye. I will actually be touching your eyelashes with it. Shouldn't cause you any discomfort. I'm just going to have you look straight ahead here for me. Good. And inner tear duct. Very good. Okay, so blink reflex is intact. So let's go ahead and move on to upper extremity reflexes. So I will start on this side. I'm going to test at the elbow. So I'd like you to just very heavily kind of let your weight fall into my hand there. Very good. I'm going to place your hand on your lap. And just like that, and just let your muscles relax. Good. And then lastly at the middle finger. Perfect. So repeat the same test on the opposite side here. So just rest all your weight into my hand. Good. And same at the wrist. Very reactive there. Good. Perfect. Okay. Upper extremity reflexes are very well intact. That's a good sign. Okay, so we can go ahead and move on here. So I'm going to test a couple checks for symmetry at the jawline. So what I'm going to have you do is turn your head all the way to the side for me. Perfect. Good. And then if you can turn all the way towards me. Go ahead and turn your head midline for me. Clavicle is midline to chest wall. Good. Now if I can have you swallow. Perfect. Okay. Just going to measure from breastbone to center thyroid. And that is good. Maybe slightly off center at the thyroid there. Okay, all right. All right, Brittany, so the next thing we are going to test is your sensory perception. So I have a couple different stimuli that I will be using to test how you're able to feel things, essentially. So are you ever noticing that you have issues with numbness or tingling of your limbs?
Not really.
Okay, so I have a very soft kind of cottony wisp here. I'm going to use this to just very gently stroke your face and your extremities. So I'm going to have you close your eyes. To start, I'd like you to just indicate yes, or you can nod your head yes if you do feel it, okay?
Yes. 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 Yes.
Very good. So this time I'm going to test for bilateral sensation. So I'm going to do it equally along both sides. I want you to tell me if it feels any different.
Okay.
So this here should feel about the same as this. In here, and here, here, and here. So just have you rest your hands at your side here for me. Perfect. Okay, so I'm just going to test out the palm. Good. And in your feet, does that feel about the same? Okay, very good. So I'm going to do a variation now with a sharper tool. Now, this is very sharp. It shouldn't cause you any pain, but it is a very distinct sensation. So just to give you an example, you're going to feel a sharp little pat along your skin, and I'd like you to just indicate when you feel it.
Okay.
Okay.
Now. 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 Now.
Very good. And lastly, now did all of that feel the same? Any sensation of tingling or pins and needles?
No.
Okay, good. So the next thing I'm going to do is produce a sensation in your hand. Now, this should mimic either a number or a letter. I'd like you to attempt to indicate what number or what letter. I'll start with a letter, and it will be capital.
Okay.
So I'll have you close your eyes for me.
B.
Very good.
M.
Good.
D.
Good. So now I'm going to do a number.
4. 9.
Good.
7. 5.
Very good.
8.
Okay, so I'm going to do that on the other side. Same thing, I'll start with a letter.
A. T. N.
Okay, now I'm going to do a number.
7.
Good.
9.
Good. And
4.
very good. Okay. So a couple discrepancies on that left side, but nothing that I would say is super concerning.
Okay.
Sometimes we read them backwards. That's okay. All right, so I think the last thing I'm going to do is perform your abdominal assessment. So just very brief, have a look over your belly, see if there's any signs of distension or anything there. Do you ever have any issues with indigestion or?
No.
No, okay. Do you eat a special diet by chance?
No.
No, okay, fairly healthy fruits and vegetables.
A lot of protein.
Okay.
Fruits and veggies.
Okay, all right, sounds good. So let me just move my tools. I'll have you lay down and then we'll perform your assessment and then you'll be good to go.
Okay.
Okay. All right, Brittany, we are going to go ahead and get started with your abdominal assessment, okay? So just gonna have a look over your abdomen, obviously look for any signs of abnormality there. So you said you don't ever have any issue with indigestion or anything like that, correct?
No.
Okay. Normal menstrual cycles, nothing painful or uncomfortable there. Okay. So just gonna start with a bit of a visual inspection. I'm just gonna adjust your clothing if that's okay. Going to move this up slightly here at the rib cage and then slightly down at the hip bone here. Okay, perfect. So just gonna have a look over the abdomen. So I'm going to start by just visualizing your respiration. So just looking for normal rise and fall here at the mid-abdomen, looking for any signs of distension there. That looks okay. Ribs are symmetrical bilaterally. Don't see any signs of distension at the umbilicus. Very good. Overall skin tone is very clear. No blemishing or abnormal erythema there. So before I start manipulating too much, I am going to just have a listen with my stethoscope. So just a quick auscultation, listening for normal bowel sounds, any abnormal digestion or issues with your intestines. So very cold here. Listening directly over the umbilicus, auscultating for any signs of umbilical hernia, just not notable. Also going to listen at the femoral artery, looking for any signs of abnormal circulation or occlusion. None of which appears notable. Very good. Okay. Very good circulation at the abdomen, so we can go ahead and move on to our palpatory assessment. So I'll start with just a couple measurements for symmetry here. So I'm just going to measure, of course, at the rib cage. So right at about the base of the breastbone there. Very good. So I'm going to ask you to breathe in deep for me. Good, and release. Perfect. One more time. Breathe in deep. And release. Beautiful. Okay. So I'm going to go ahead and perform some palpations here. So just feel around with my fingers here, just palpating along the bony prominence. Feeling for any abnormality there. So down along the mid-abdominal wall. Just doing a bit of a deeper palpation around the organs, feeling for any signs of distension, any abnormal bloating. We're just going to feel at the kidney here. Palpating along the pelvic bone, no signs of misalignment there. Okay, so I'm just going to percuss with my reflex hammer. So you're just going to feel tap along your rib cage here. Last thing I'm going to do for your abdominal assessment is just test for your abdominal reflexes. So you have several nerve endings and muscular reflexes in your abdomen that should cause you to flex upon stimulation. So firstly, I'd like you to just tell me if this sensation here and this sensation here feels about the same on both sides. Okay. Now for the next sensation, you're going to feel something very sharp. You do not have to indicate whether or not you feel it. I'm just looking for a normal reaction of your belly, essentially, okay? So it might tickle slightly here. I apologize. Very good. So very healthy reactivity of the abdominal muscles. Test for cold response as well. Very good. Okay. It's very healthy response of the abdominal reflexes there. So we can go ahead and proceed with the examination of your lower extremities. So let me just return your clothing to its original position here. All right, Brittany, so we are going to go ahead and move on to the test of your lower extremities. Any issues with your legs or your feet?
No.
No pain in your feet?
No.
Perfect. What footwear do you say you wear on like a typical basis? Are you wearing sneakers?
Sneakers.
Sneakers, okay. All right, I'm just going to start by having a look at the upper thigh area, palpating around for any abnormality there. Skin tone again is even and clear, not noting any signs of abnormal lesion or abrasion. A couple scars on the legs, but that is totally normal. Joints feel okay. Very healthy muscle tone. Is this a birthmark here?
No, I got in a bicycle accident a few years ago.
Okay. So it does appear to have healed fairly well, just some scarring there. Okay. What is your typical method of physical activity?
I lift weights.
Okay.
I jog a few miles.
So feet are very cold. Do you have issues with circulation, or do your feet just tend to run cold?
They typically just run cold,
Okay.
but I wear socks a lot, so.
Okay. Little scar here. Just going to gently check. So I am seeing a bit of a delay in your capillary refill here. Your toes are not getting quite as much circulation as I'd like to see. Okay. You do have very long legs in comparison to your torso, and I do tend to find that my taller patients have a little bit colder feet, so it's not something that I would say is particularly concerning. Something to keep an eye out for if you see that your toes are gray or purple in coloring. Obviously, that can be a bit concerning. If you're noticing that you're having any symptoms of abnormal blood circulation or abnormal blood sugar, then we might be looking at diabetes. But I think for now you're okay. You are fairly healthy, so I don't think it's anything that's of particular concern. So I'm just going to have a look at the lower joint here. Okay, so just looking at the plantar side of the foot. No issues with roughening of the skin. Nail beds are very healthy. Okay, so I'm going to do a couple tests for strength of your feet. If I could have you push down like you're stepping on a gas pedal. Very good. And this side. Good. And up. Perfect. Up. Can you scrunch your toes really tight and spread them out as far as you can? Very good. Okay. So very good joint mobility there. Just going to feel around a little more here. That feels okay. All right. So I am going to, let's see. Just want to do, so I do see that your right knee appears slightly lower than the left. About 18 inches there. Okay. Okay. 7 1/4. Okay, so fairly symmetrical there. All right, now I'm just going to do a test for your Babinski reflex. Now you have a neurological reflex at the bottom of your feet. I'm going to elicit that response by bringing a cold, sharp object across your foot. Shouldn't hurt, it is slightly ticklish, so just to give you a warning there. So just relax your feet as much as you can. And I'm just going to hold your foot here. Slightly delayed response there, probably due to the lack of circulation. Okay. So test that one more time with something a little more specific. Okay, so a little bit of a better response there. All right, Brittany, if you can go ahead and come back forward for me. I'm just going to test the reflexes at the knee. So just relax for me here, slightly uncomfortable. Good. Very good reflexes at the knee. Babinski response was just a little bit delayed, likely because your feet are very cold, so that's okay. All right, Brittany. Well, the good news is that completes your head-to-toe assessment today. Everything was normal. I didn't notice any notable abnormalities. Your palpatory exam was completely normal. Your cardiac health is well intact. Obviously, you're very physically fit, so it's performing well for you. Now, I did notice just a bit of a circulation issue with your feet, which was slightly concerning. You had a bit of a delay in your Babinski response, so I would recommend continuing with sneaker use. Open-toed shoes obviously can pose a danger to your feet, especially if you're having a bit of a lack of circulation there. Otherwise, just keep an eye out for any purpling of the toes, any signs of numbness. If you ever have an abrasion of your feet that you didn't notice or you can't remember when you got it, that could be particularly concerning. Otherwise, I would say we are okay. Did you have any questions for me today?
No.
Okay, so you are in very good health. If you'd like, we can go ahead and schedule your next annual visit for you. That way, a reminder is sent out via email. Otherwise, you are welcome to call and schedule at your leisure, okay?
Okay, thank
All right,
you.
well, thank you very much. It was very nice meeting you today.
You too.